Welcome to Missoula Bone and Joint Surgery Center. This video will serve as a virtual walkthrough of your surgery. We hope it helps prepare you and puts you at ease. In preparation, it is very important that you do not eat or drink anything 12 hours prior to your surgery. Please arrive an hour and a half before your surgery time unless instructed otherwise. Wear loose, comfortable clothing and make arrangements to have a responsible adult drive you home. Our entrance is located beneath the blue and silver awning. Upon entering, you will be greeted by a receptionist and admitted for surgery.
Good morning, how are you?
Good, how are you?
Good, it's good to see you.
She will verify your basic information. Please bring your driver's license, insurance cards, and emergency contact information. Insurance copays and facility fees will be collected at this time. If applicable, cold therapy fees will also be collected. You will be asked to sign 3 admission forms: a privacy waiver for your anesthesiologist, a privacy waiver for our facility, and a financial policy form, which will acquaint you with our billing policy and allow us to bill your insurance.
Okay. All right, you guys just have a seat. Maxine will be with you in just a second.
All right.
Thanks so much. Good to see you.
Sounds
Thanks,
good.
you guys.
Thank
okay,
you.
You're welcome.
After the admission process is complete, you can take a seat in the waiting area. Shortly thereafter, your preoperative nurse will greet you.
Hey, Kevin.
Hey there, how are you?
Hi.
At Missoula Bone and Joint, our nurses are certified in operating room care, pre- and post-operative care, or both.
Nice to meet you, Maxine.
Family and friends will be allowed to come back with you. For the privacy of all our patients, we ask that you limit visitors to 2. At this time, you will have an opportunity to use the restroom. It is important to empty your bladder prior to surgery.
Come on over.
Once in the preoperative area, your nurse will instruct you about each step of the pre-op process and briefly touch on post-op instructions. She will verify your procedure, name, date of birth, height, weight, health history, medications, and allergies. She will also confirm that you have had nothing to eat or drink in the past 12 hours. Next, you will be asked to change into a patient gown. You'll be given a patient belongings bag to store your clothes. Please give your jewelry and valuables to a family member or friend for safekeeping.
Kevin, I see you're tucked in.
Yeah.
Once changed and in bed, the nurse will take your blood pressure, pulse, temperature, and do a physical assessment. She will start an IV that will easily enable the introduction of medications, such as antibiotics ordered by your physician.
There you go.
Thank you.
Next, you will meet your anesthesiologist. The anesthesiologist is a board-certified physician specializing in the practice of anesthesia.
Hello, good morning.
How
Are you Kevin?
Yep.
He or she will examine your heart, lungs, and airway, discuss your medical history, go over the plan for the anesthesia, and answer any questions you may have.
Good.
Any questions at all?
No, I don't think so.
All right.
Thank you.
See you in a little bit.
Yep.
Okay.
After that, your surgeon will meet with you to explain the procedure, mark the appropriate area for surgery, and answer your questions. At Missoula Bone and Joint, all of our physicians and surgeons are board certified.
All right. Let's see you in a minute.
Next, you will meet your operating room nurse, who will be with you throughout the surgery. Her main priority is your comfort and well-being. She will check your identity, review your health history, and ask you a series of questions to provide the safest and best possible care for you. At this time, your family and friends will be asked to return to the waiting area.
I'll take good care of him.
Thank you.
Every effort will be made to ensure they are comfortable while they wait. You may receive a sedative through your IV to help you relax. On the way to the operating room, your nurse will comfort you with warm blankets. Our staff is extremely helpful and caring. Their main goal is to ensure you are comfortable and fully informed. They will happily answer any questions you have at any time. Please don't hesitate to ask. Your anesthesiologist, a surgical technologist, and an additional RN will be awaiting you in the operating room. The surgical team will fit you with a blood pressure cuff, an EKG monitor, and an oxygen sensor. For general anesthesia cases, you will be asked to breathe oxygen through a loose-fitting plastic mask, and you will drift off to sleep. Once unconscious, the surgeon will begin the operation. During the surgery, the anesthesiologist will be vigilantly monitoring your vital signs. The anesthesiologist's focus is to ensure your safety, comfort, and for general anesthesia cases, that you remain unconscious. After the operation is complete, you will be taken to the post-operative recovery area. You will be greeted by the post-operative nurse. You will once again be connected to monitors. Your anesthesiologist will confirm you are emerging from anesthetic medication safely and sign your care over to your nurse.
All right, any questions at all, Tom?
No.
Okay, thanks. Good luck, Kevin.
Thank you.
Your nurse will monitor your vital signs, evaluate your pain, nausea, and medicate as needed. You will be encouraged to take fluids and food as tolerated.
Okay, swallowing okay?
Yeah.
Good.
As you move further into the recovery phase, your family and friends may come back and visit. Your nurse will go over your discharge plan and orders with you and the responsible adult that is driving you home.
So the important thing is with the dressing to keep it clean and dry 4 days.
All right. So what you did?
You will then get back into your clothes. Assistance will be provided if needed. Once you are feeling up to it, you will be discharged and your nurse will gladly assist you to your vehicle.
Just be careful standing up. I'll help you with it. You might be a little wobbly. Okay?
At Missoula Bone and Joint Surgery Center, we take pride in having a top-of-the-line facility, a staff made up of experienced, caring, and certified professionals, and an infection rate of less than 1%.
Thank you. Heal up. See you later.
We hope this virtual walkthrough has helped to put your mind at ease and prepared you for your surgery. Thank you for watching and thank you for choosing Missoula Bone and Joint Surgery Center.